Hi everybody, this is a video about methylene blue. Just before I jump into the crux of the video, if you don't mind taking a quick minute, or a quick second actually, just to like or share, subscribe, or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. So I posted a video a little while ago about combining methylene blue with red light therapy, and there were a bunch of questions that were posted on that video, so I'm going to just run through those in rapid fire fashion. As per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. So the first question is a really quick one. It says, what's the best time of day to use methylene blue? That's a great question. I mean, it really depends. If we're using it for general antioxidant enhancing purposes or antimicrobial purposes, it probably doesn't really matter. I never really advise my patients to take it at a specific time. Typically, I typically dose it once or twice a day, usually breakfast time, lunchtime, that kind of thing. But I don't really specify what time of day to take it. Now, if a patient said, "Oh, I take the methylene blue and it really helps to give my energy levels a boost because my methylene blue is good for mitochondrial function," or if a person was combining it with red light therapy, I would typically recommend they take it more earlier in the day because there could be that hopefully that energy enhancing effect, and you wouldn't want to necessarily do that right before going to bed. So that would be my general thought on that. Let's see here, another person saying here, what about using methylene blue when someone is also using hydrogen inhalation therapy? Are the two complementary or antagonistic? So both methylene blue and hydrogen are antioxidant. So methylene blue is a very, very strong antioxidant, arguably the strongest antioxidant substance a person can take into their body internally for therapeutic purposes. And hydrogen is also antioxidant, in large part because it scavenges free radicals, and that's largely what antioxidants do, but it does it in kind of a unique method, which I think is pretty cool. So they are definitely complementary. Now, hydrogen peroxide therapy, if people are getting, say, IVs with that, for example, then that would be antagonistic because that's a pro-oxidative therapy. But hydrogen itself, antioxidant. It says, what if a person is already on a high antioxidant supplement regimen? Is methylene blue complementary or antagonistic? So again, they're all antioxidants, so they are they would be complementary to one another. Let's see here, and the last one is, isn't methylene blue photosensitive? Or I think the person meant photosensitizing. So wouldn't that irritate the skin if used in combination with red light? Methylene blue is a photodynamic agent or a photosensitizing agent, so it does absolutely absorb certain wavelengths of light, particularly certain red wavelengths of light, which is why combining it with red light therapy, like topical red light therapy, can be therapeutic, kind of giving additional benefits. I haven't heard of anyone getting sunburns or having skin irritation combining like just being out in the sun with methylene blue, or getting skin irritation using methylene blue in combination with red light therapy, and that includes intravenous red light therapy. So that would, my thought is that if the combination or the interaction of the methylene blue and the red light wavelengths would cause tissue irritation, you'd get some notable issues when that's done intravenously. So I can say, based on our clinical experience here, we don't see that kind of irritation happening to the endothelial cells lining the blood vessels, and I've never heard of a patient having any photosensitizing issues from you taking methylene blue in general and then just being out in sunlight. Certain medications, like famously doxycycline, the antibiotic, is known as a photosensitizing agent. So when a person's on a doxycycline prescription, they're told to avoid direct sunlight, try to use as much sun protection as possible, and stay out of the sun as best you can, because it will cause skin irritation. But I've not seen that with methylene blue. So thank you for the questions. If anybody has any further questions on this topic or anything else, just post it in the comment section below, and I'll do my best to answer as soon as I can.